Hello, welcome back. The topic today is diabetes and our immune system. How diabetes affects or impacts our immune system. So we all know diabetes means raised blood sugar level, where there is either less insulin or inefficient insulin level leads to rise in blood sugar level. And most of the people they all know when they come to the doctor they always say when I get wound in the wound heals very fast. So they say I have a good sugar control. That's what they say. I had a cut in my leg and it healed very fast. That's what they say. So the same way everybody knows if diabetes means they are known it can cause infection. Why? Simple. First is diabetes is a chronic disease and it's a metabolic disease. It can affect everywhere, especially your blood vessels, microangiopathy or macroangiopathy. That means micro means small blood vessels and large blood vessels. Especially the microvascular system is affected. So uh, the blood supply can be affected to that particular organ, and the same way it can affect the nerves, so neuropathy. So when the generally in diabetes, suppose we have a water and you add sugar to the water, it becomes thicker like a molten thick liquid. The same way when the blood sugar rises in our blood, the blood becomes more thicker. When it becomes thicker, it's very difficult to circulate, and it is very difficult to penetrate the small blood vessels, and especially in diabetes the small blood vessels are affected, so the blood cannot flow into the small blood vessels. So the end tissue, the target tissues cannot get the nutrition, oxygen, glucose, and immune cells cannot reach that, so it can lead to infection. And not only that, since the you know they can get easily the communicable diseases, like suppose uncontrolled diabetes, they are exposed to aerosols, then pneumonia can happen, TB can happen, and they can get repeated urinary tract infections. In a person gets repeated urinary tract infection, always we have to check uncontrolled diabetes. So they're prone for infection. Something same thing, suppose there is a sugar, the ants will come, insects will come. The same way if your blood sugar rises, the opportunistic infections, the bacteria, virus, fungi, anything can come. So sugar attracts infection, opportunistic infections. And in diabetes, mostly they have a dry skin. The secretions in diabetes, all the secretions, whether it's your tears or skin, oil, everything is dry. So when oil dries in the skin, it's a dry skin, and it's itching can happen, or when the oil, I mean the skin is dry, easily infection can go. So that is why, and they also sweat a lot. That is why most of the diabetics will have a small black scars. There are healed skin infections. You can see, especially the lower leg, you can see a lot of black marks, the scars. They show the healed, infections, skin infections. And not only that, the in diabetic, the antibodies formation. So suppose there is an infection, we have a memory for this bacteria or the virus. This antibody production is very less. Not only that, the natural killer cells, neutrophil, macrophages, these all the first line of defense mechanisms. So when an infection comes in, these are the natural first defense mechanism. They're all impaired. And not only that, the body cannot recognize the infection. Suppose an entry of bacteria is there, body fails to recognize in uncontrolled diabetes. It fails to recognize the pathogen. So once it goes in and it multiplies, then only body recognizes. These are the reasons why the immune system is affected in diabetes, uncontrolled diabetes. If you have a diabetes, you accepted, you understood the problem, and you're taking care of well of your diet, exercise, and medicine, then you have a good control of the diabetes. Your immune system is definitely will be functioning very normal. So consult your doctor, keep your blood sugars under control, and follow his advice. Thank you.